Education series. My name is Zavanya Covington, and I am the Community Partnership Coordinator for Faith-Based Partnerships and Senior Strategies in the Social Responsibility Department here at Baptist Health. Our topic for this month is nutrition. We have three very special guest panelists joining us tonight, whom I will introduce in just a moment. But first, I would like to review tonight's agenda. So I will review a couple of housekeeping items. We will have a special panel and panel discussion and Q&A. And finally, we will end with some brief closing announcements. So just a few housekeeping items I wanted to review tonight before we get started with the presentation. So we will be recording tonight's session, and it will be made available to all of the registrants after tonight. Secondly, we are tracking attendance. So if you have invited others to view with you who didn't have an opportunity to register, we first say thank you so much for spreading the word about tonight's session. So we just ask that you add their names to the chat so that we can document it for our attendance records. And thirdly, my director, Lynn Sherman, she will be the moderator for tonight's discussion, and she also will be monitoring the chat. So please feel free to type your questions there, and they will be addressed at that time. In addition, something special that we're doing tonight as well is that we will be opening the microphone at the designated time to those who would like to ask your questions to the panelists directly. So there will be a time to do that. So without further ado, I would like to introduce our panelists for the evening. Before I turn it over to Lynn. So first, Miss Rachel McCandless, she will be joining us soon, but Rachel is a registered dietitian and director of health and nutrition at Feeding Northeast Florida, serving 8 counties surrounding Jacksonville, Florida. She oversees Project Share Prepared Meals, Corner Market Mobile Grocery, Health Pantry Network, and the Prescriptive Nutrition Healthcare Partnerships. Next, representing the Black Church Food Security Network, we have Ms. Lauren Husband. Lauren is the Director of Public Policy and Community Engagement at Feeding Northeast Florida, where she is responsible for engaging with stakeholders ranging from government officials, organizations, schools, and community members on related issues to poverty and food insecurity in the region. And finally, we have Dr. Tanetta Lanes-Bynes with Bridge the Gap, Inc., where their mission there is to mobilize volunteers and entities such as government, faith, health, business, and the community at large to partner in filling the gaps that exist in the delivery of fundamental social services to elderly and disabled citizens. Thank you all so much for joining us today. So Lynn, I will now turn it over to you to begin the panel discussion.
Good evening, everyone, and thank you for being with us this evening. The topic that we're going to be discussing this evening on the subject of nutrition is a very interesting topic. And it's one that is not often very comfortable for us to talk about, for many of us. But tonight, we have some experts that will be sharing with you some very good information that you all will be able to take away this evening and actually use when you leave here. 60% of the men and women are diagnosed as overweight or malnourished here in the United States. These really are only 2 of many nutrition-related conditions that can result in cardiovascular disease, diabetes, and all sorts of disease. So fortunately, people realize that the need for a healthy lifestyle is really significant. It is really something important that they should do. But however, the USDA concluded as a result of doing a survey they completed back in 2000 that regardless of what people know about health, they choose not to improve their diets sometimes, especially when they may not know. They may know, but yet again, they may not know. There are several factors that contribute to this: lack of motivation, including some of our learned behaviors. We were taught as kids to always clean your plate, never leave anything on the plate, eat whatever is in front of you, whether it's nutritious or not. So, but tonight we're going to have a conversation. We're going to have a conversation with these local nutrition experts. And as you heard their bios, they are certainly experts in their field when it comes to nutrition and what you can do to ensure that you always have access to fresh fruits and vegetables living here, believe it or not, in our city and here in Jacksonville. I'm going to start with our Dr. Husband, our Lorene Husband, as she's asked me to refer to her during this panel discussion as Lorene. Lorene, you are very much involved with growing local food, local fresh foods and fruits and vegetables primarily. Why do you think it's important for communities like ours to grow local food? Why is that significant?
I don't know if our audience, the participants, know this fact, but in Jacksonville or well, in Duval County, if we have a major disaster, and the question of if is not a supposition, we will have a major disaster or a few major disasters coming our way. In case of a major disaster in our area, we actually have only 3 days of food on our grocery shelves. So if I-95 and I-10, as well as the transportation systems that come through the St. Johns River, were unavailable to bring us food, as well as CSX, we would only have 3 days worth of food on our shelves. And so if you think of the magnitude of that statistics by itself, and then think about communities that are already food insecure, it thus becomes imperative for us to be able to prepare for the future, as well as for what's coming to us, which we know is just a matter of time. We have to start strengthening our local food systems, Lynn.
Thank you, Lorene. That is a very interesting response. I assure you that many of us have not thought about what happens if there is a disaster and how we would actually find fresh fruits and vegetables, and if we don't have access to grocery stores to go and get those fresh fruits and vegetables, we haven't really thought about what next, what else can we do? So that's really good information. And I would like to ask you, Tonetta, Dr. Barnes, your family has a garden, a community garden called Bridge the Gap. And you're growing fresh fruits and vegetables all the time. And then you're also working with community members on how they can grow fresh fruits and vegetables. Tell us a little bit about Bridge the Gap and what are some of the goals of Bridge the Gap, your garden, and what are some of the things that you hope to accomplish in the community by having this garden?
Absolutely. Thank you so much, Lynn, for this opportunity to sit on this panel with such wonderful individuals for Baptist. Greetings to our listening audience. Again, my name is Tonetta, and Bridge the Gap is a community service center. We have been serving the community for a little over 40 years. We are not new to the Brentwood community or the surrounding area. Just a little background history. This organization was founded back in January of 1982 by a wonderful individual who just so happened to be my grandmother, who is now gone on, Miss Catherine Hester McNair. And what she did at the time when she established this organization, President Ronald Reagan was in office, and he was making a plea to the United States for individuals to step up and do something for our elderly and those that were disabled. And she took a hold of that plea from, at that time, President Ronald Reagan, and she did something about it, which is a result of Bridge the Gap today. Now that she has gone on, Miss Yvonne Lane, her daughter, has taken her legacy and picked up the baton and has continued the original mission of the organization, which was shared with you all by Miss Covington at the opening of this panelist discussion. However, since that time, we know that as time changes, need changes, doesn't necessarily mean that the mission of the organization changes, but we do have to make sure that we are in a place where we are being relevant to the needs of the community at the time. So my mom, being the visionary that she is, she noticed that there was talking about the area that the community sits in, which is the Brentwood area, that is considered a food desert. And if you take a ride out there, you will see that there are no grocery stores near in that area. So what happens? The people in that community revert to fast food. They revert to corner stores, and we know that food that they're intaking is not healthy for their bodies. So as a result, my mom had a vision to start a community garden, which we call the Garden of Eden Farm. And if you know anything about the Garden of Eden, it is a place that is full of fruits and vegetables. It's full of peace and joy. It's full of a place where individuals can just come and sit and relax and think. And so the part of the mission and goal of the Garden of Eden is really, number one, to restore respect back to the community. If you notice, when individuals don't respect earth or nature, they throw things on the ground, paper, and just litter on the ground, and not knowing that those things are harmful to our earth environment. And when you're in a place where you need the earth to help supplement the food that is being distributed from other places, I believe what Dr. Husband said was so vital, because we cannot depend on companies. We really have to look back and depend on the earth that was designed to sustain us. So that was one of the goals. Another goal is also to build up the community. Let that garden be a place where the community can get together regardless of your status, regardless of mistakes that you've made. Come, let us work together. Let's tilt the land. Let's plant some seeds and see the manifestation of healthy food growing, so that we all can live a longer and more empowered life in the community.
Thank you,
Back to you,
Dr.
Lynn.
Yeah, thank you very much, Dr. Barnes. This is that you shared with us some really important information that we should all know and take a hold of and understand. And you spoke to food deserts in our community and what they have done really to the health and the lives of people who live in the urban core, where there are no grocery stores. And you also mentioned how relevant gardens were and how relevant having a community garden is. And I wonder, Dr. Husband, if you would just speak on your work. You've been doing some work with the Black Church, and many which are located in the urban core. Why did you decide to organize the Black churches in our region to grow food and to support local food systems?
So the Black Church Food Security Network was founded in Baltimore, Maryland. And the Reverend Dr. Brown noticed that he too had a food mission like most churches. And he was always giving charitable food that is recovered from grocery stores. But he wanted to supplement that food with fresh fruits and vegetables. So he went to the nearest grocery store near him. It was a Whole Foods. And based on his food budget at his church, he noticed that he could not afford to buy for the congregation that he was serving the amount of food that he needed, because it was just simply too expensive. And so he went back to church and he looked around. And he's like, we have all this ground, on our land. We have our own land. Why is it that we are not growing food? So, and I was looking in Jacksonville, for example, in zip code 32209, we have probably 45 agency partners for Feeding Northeast Florida, which is the organization I work for. And those churches provide foods in our neighborhoods. So if you look in 32209, we also have 187 churches. That's a lot of real estate. So imagine if every single church grew food at whatever space that they do have, whether it's it's in actual ground or in containers, vertically on, different devices that you can use to grow food vertically. How much could they supplement the food that we as a food bank provide to them? So that was my first, that's what propelled me to start thinking of this. And then when I looked to see if anybody else around the country was doing it, that's how I came to find the Black Church Food Security Network. I reached out to them, and then Dr. Brown, the leader, came to Jacksonville in April, and we launched the Black Church Food Security Network in Jacksonville. And we currently have 17 African American churches that are growing food. And in fact, we just harvested what in the South, Lynn, you'd probably call a mess of green beans yesterday, and okra, as well as eggplant. And to be able to actually supplement the congregation or the folks who are coming to get food through the food pantry with food that you actually grew, the sense of pride that comes from that. And then people start asking questions. The folks coming to get the charitable food start asking questions when they see the farms and the gardens on these church grounds. They're asking, how can we too grow our own food at home? So now we're starting to teach our neighbors how to grow food. So Lynn, I hope I answered your question, but then you do realize there are some cities like the city of Detroit that has completely reclaimed its local food system, or a city like the city of Havana, Cuba, which grows 70% of its fresh produce within the city, where churches, other organizations, residents are growing food. Thus becoming food independent and being able to control the nutrition and what you put in your body, because you know exactly how it grew, what you put in it. And we're teaching regenerative agricultural methods so that we're not using any chemicals of any kind on any of these gardens. So we know that our folks eating this food have the potential to be healthy and lead much healthier lives.
That is just amazing. It is amazing work that both of you are doing in terms of creating community gardens just in different environments and different communities of people. Dr. Husband, I want to ask you, when a church has a garden and are they sharing this food with the surrounding community, or is it just for members of that particular church? How do they share the wealth? I know you said that the community can see the garden, but is the community, are members allowed to take part in feasting off of the garden?
Yes, one of the reasons for the Black Church Food Security Network actually is to bring people back to church with that, like Dr. Barnes said, the church also too has to become relevant to the community. So instead of just using the food missionary to just hand out, how can you bring the community back in to not only help to grow the food, but to literally break bread together? So we have seen, for example, there's a church near the Paxson High School area where we're starting to see individuals who have never come to that church in their lifetime, even though they're neighbors, have started asking about the garden, coming to the garden to learn about what's growing in the garden, and being able to pick the okra to take home. And now they're beginning to have relationships. So it's not just about growing food. Growing food, like we all know, food is the thing that connects us together, regardless of what our ethnicity, race, etc. It's one thing we all do. And if we can find a way to break bread together, we start developing relationships, not just around food, but around our families, around what's important. And we're using this as a tool for community organizing to build our community. So all the things besides nutrition, things like crime and violence, social isolation that's killing a lot of our elderly, all those things, we're trying to break those cycles by using food as a leverage.
Thank you, Dr. Husband. You mentioned families and and celebrating food around families. Is there a mechanism or a way, and I'd like for both of you to respond to this based on where you have your gardens. Is there a way or a process, a program that brings children into this? Because we know the younger you start, the better habits you're going to pick up, and you're going to eat more nutritious at an early age, and you're more likely to continue it on into young adulthood and as you get older. So what are some of the things you're doing to engage young people, to engage children? And if Dr. Husband, if you'll answer that, and then Dr. Vines, if you'll answer that next, I would appreciate it.
So we have community farm work days, and on community farm work days, they are multi-generational. And the last one we hosted, we had 116 participants. And of those 116 participants, we even included on the work assignments, they were work assignments for children, so that they too can start learning and interacting with the soil, interacting with the plants, learning why it's important to do irrigation, learning about companion planting, and even learning about fish, how to fish, and how fishing and the water that fish grow in is one of the best fertilizers for growing plants. So we're integrating that. And in fact, yesterday, in talking to Dr. Brown in Maryland, they are now piloting our partnership with the school district, of which we hope once they finish this initial pilot of a year, we will be able to replicate the same by partnering with the school district and integrating those lessons into the everyday curriculum of our children.
Well, that is fantastic. That is certainly a way to include children into the process from the very beginning, and not say, do as I say, not what I do. And Dr. Vines, how about you?
Absolutely. So we have already partnered with the local schools in the community. We have established a curriculum that includes children of all ages. That curriculum is based on teaching them the fundamentals of knowing how to plant, things to look for, as well as allowing them eventually what they'll do, whatever they plant, they get to take with them. One of the things that we've noticed is, and Dr. Lynn, you said this earlier when you were opening up the call, you stated back in your days, whatever was set before you, you ate it, right?
Mm-hmm.
And so with this generation, if it's not set before them, they can't eat it. They don't even recognize some of the basic vegetables that are, I know Lorene mentioned, eggplant, right? I was one of them. I saw an eggplant and I was like, I'm not going to eat that. But when you learn how to eat it, and someone made me eggplant parmesan, and man, that was the best dinner. And so our goal as we go into the surrounding schools, even the children that are in the community have come out, the daycare that's near the center, those babies have come out, they've gotten their little hands dirty because they are so inquisitive. And if you can catch their minds at an early age, then it won't be a struggle to try and teach them a better way of eating because it is already embedded in them. So it is extremely important that one of the goals that we have, which thankfully is coming into fruition, we're partnering with these schools, and the school leaders are open to this type of curriculum because not only does it teach the children or help the parents at home, but it also helps the school. And hopefully it can be a greater impact to the food that is supplied in the cafeteria. So what is happening here is so far greater than the four squares of a community. This is something that can really hit the nation to change the healthy lifestyle, the results of medical issues because of food that we're eating that has so many chemicals. Our garden is chemical free. We also have 18 chickens that are laying eggs fresh eggs. And I'll tell you, since I've experienced eating fresh eggs, I do not buy eggs from the store. There is such a difference. And so we'll talk about this later, but individuals are welcome to come and partake in these things, because I'm telling you, it is a positive life changer. But we just have to continue to be the forerunners, as we are, to teach individuals. Come on, we can do this together. Let's learn together.
I love it. I love it. I love it. So good to hear about all the wonderful things that are happening, especially with children at a young age, and really bringing them into this early so that they will learn to eat healthy at an early age. This is just absolutely wonderful. You started a little bit, Dr. Bynes, talking about how you plan to expand your work into the community. So what are some things that you're planning to do, not only to invite the people who are currently involved, but how do you expand and how do you bring more people into what you're doing right now?
Absolutely. So what we're currently doing, our organization gives out twice a week. We distribute or serve over 2,000 individuals on a weekly basis. That includes those that are homebound, those that are in community service centers, and we supplement the food. Thankfully for the partnership with Feeding Northeast Florida as well as Baptist, we supplement the food that we receive with what we have been able to harvest in the garden. What we are looking to do, we are actually on phase 5 of the garden, and we are expanding the garden to have a space for more raised beds, because we've noticed that if you keep the seeds from off the ground, so you avoid a issue that you could have with bugs and just all of the little things that happen with animals when they see seeds, they're coming trying to steal the seed. But we're noticed a great success rate with raised beds, and that's one of the things that as we engage the community, that those that have already been involved, we teach them how to plant in a raised bed so they can take it with them on their porch. Right? Because some people may be in an apartment complex, they don't have access to land. Here, take this raised bed. You can put this on your porch and you can grow and see the manifestation of the seed that you've planted in that raised bed. That's one of the areas where we are expanding. We've also have a great partnership with the city of Jacksonville, and they are, because it is related to building up the community, they have given us certain things to make sure we have the irrigation needed, we have the lighting needed, we even have the electricity needed for some things that we need in the garden. And so all of that is a part of expansion, and even partnerships that we have inquired. Baptist is one of them, different organizations that have seen the garden and want to buy into it and help to expand it, so that again, it grows well beyond just a Brentwood community area, but it extends out even further. I hope I answered your question.
You answered my questions and more, and I love it.
Right.
And thank you for all of the good information that you shared with us, because it's information that our community needs to be aware of, because it's so important that people understand what the possibilities are, not just what is, but they understand that there is possibility even for them. So our registered dietitian has joined us, and thank you, Rachel McCandless, who was introduced earlier by Zavanya, who serves as our faith-based partnership coordinator, is here with us now. And Rachel, we're so glad that you were able to join us, because I have these questions that I know that you are the right person to answer. So many people just simply, Rachel, don't believe that people in this country could ever be malnourished, because they think they see food everywhere, whether it's good food or bad food. So what does it look like for a person, as a registered dietitian, what does it look like for a person to be malnourished?
Thank you, Lynn. That is an awesome question. And first off, thank you for having me. And I apologize profusely for being late. I was having some connection issues. But I'm very glad to be here now to answer that question. You know, we live in the most prosperous country in the world. We produce most of the food for the world. We are the breadbasket of the world. We have food on every corner. How can Americans be malnourished? Well, malnutrition isn't necessarily what you might think of first off. You know, an elderly person that's way too skinny, or a child that's way too skinny, dies of failure to thrive, not getting enough to eat. Yes, that is malnutrition, but malnutrition is also, mal means bad, nutrition, bad nutrition. So when we live in neighborhoods where, you know, all we have access to is fast food, that's malnutrition. When we're not getting enough nutrients to live a good life, when we're not getting access to fruits and vegetables, to lean proteins, to a full and varied diet, that's malnutrition. You can look at somebody, and you can't look at somebody and see, oh, they're malnourished. But many people who are obese, you think, I can't have malnutrition. There's the fancy word for it is sarcopenic obesity. And really what it means is you've got very little muscle mass and a whole lot of fat. And we see a lot of that in America. We have malnutrition, and it's in your neighbors, it's in your community, it's in people you see all the time, but it's not necessarily what you might think of when you picture malnutrition.
Thank you, Rachel. That's really good information, and we really do appreciate you sharing that, because there are a lot of people, a lot of us who think that if a person is obese, just like you said, they can't possibly be malnourished. Because they're eating a lot of calories, a lot of what could be, as you mentioned, empty calories, calories that don't mean a whole lot in terms of nutrients, as Dr. Bynes and Dr. Husband has been sharing with us of the beautiful food that they're growing. But many people sometimes think that, Rachel, that eating a certain kind of food can cure, or it might be able to prevent disease. Tell us a little bit about that. Is that possible? Tell us what you think about that.
That is an excellent question, Lynn. Thank you for asking that. Man, as a dietitian, like, I wish that there was like a miracle food I could say, here's this miracle food. It'll cure your diabetes, or it'll make you lose weight. I wish so much. Imagine the suffering we could alleviate if there was a magic food. But sadly, there's not. No matter what the marketing people say, no matter what the supplement people say, I tell my patients this: if there was a magic food, don't you think everybody would have it? Some company would be out there making billions and billions of dollars off of it, not some supplement maker telling you that it's a secret that nobody wants you to know. You know, if there was a magic food, believe me, it would be out there, and we would all have it. Food is not magic. Food is not poison. It's the reality lies somewhere in the middle. You know, it's balance, it's variety, and it's moderation. We as Americans just eat way too much of everything. And we don't have enough variety. Red things, yellow things, green things, purple things, you know, your fruits and vegetables, those colors are where the nutrients are. You know, so purple things have some really awesome nutrients. Red things have some really awesome nutrients. So the more colors you get in your diet, that is the closest thing we have to magic.
That's so interesting. And when the other two panelists were talking about what's growing in the garden, it was about color, and it was about, you know, balance of all of those things, just the things that you just mentioned, actually, and how important they are that you do that. Dr. Husband, I'd like to go back to you just for a minute and just talk a little bit more about the Black church and organizing churches together. What are some of tell us more about the benefits you're seeing from organizing and bringing Black churches together. And then why Black churches? Why not white churches? Why not, you know, Jewish faith organizations? Why not? Why Black churches? Because you're specifically speaking of the Black church. Tell us more about why that's the case.
Well, traditionally, Black and Brown communities are the most food insecure and also in terms of grocery store access because of policies and systems that have been created over time. Those communities have the least opportunities for neighborhood markets and grocery stores. So that's where we're starting. And it's not just limiting it to just this one group of people, but we have to start somewhere. And so we decided to start there. And why? Well, for one, because they're food insecure, but also in terms of organizing community and building community. The Black church, if you look at the civil rights movement in the United States was mostly led by faith organizations, whether they were Jewish organizations, Black churches, Catholic organizations. So the faith community has traditionally taken, historically, traditionally taken American problems and done the work it takes to change those inequities and injustices. So it made sense. How do we begin to start talking about food access and good nutrition? We also talked to ministers who are simply tired of spending most of their weekends attending funerals of people who are dying from nutrition related diseases. So how do we change that? We need to be able to give people access to fresh fruits and vegetables, as well as raised, meat that's raised without a lot of chemicals, because we're also seeing the increase in diabetes, the increase in cancer in our communities, some of which are diet related. And so this is a solution that we have right at our fingertips. And we have the earth that God has given us, the spaces. And why can we use those spaces to activate magic by creating this thing called good nutrition?
Thank you for that. Would you add to what you just said, Dr. Husband? What are some of the barriers? We know that this is not just easy. You just, fly in there and you teach people how to create a garden and with the Black church, and then they just fall in line and do exactly what you say. What are you doing to convince them? First of all, how are you convincing them to do it? What are some of the barriers? But also, although you've talked about some of the successes, what are a couple of successes that really are important to people? How do you convince them? What are some of those successes that they can see instant reward and want to continue this work?
The first one is around community organizing and community building. So at our first fundraising, we had 11 congregations come together to raise one church fund together. So I don't know if you know about the South, most denominations tend to stick to themselves and they don't work together. So bridging that silos of congregational barriers and bringing them together to where they both say, we are one body and we're going to do this for the benefit of one another is really important. So in talking about the barriers, one thing about churches is they're aging. A lot of young people are not going to church. So when you have 60, 70, 80, 90-year-olds plus out there trying to farm, it's really difficult because simply their bodies sometimes are failing them. So to address that age-related physical disability of working in Florida's hot sun when it's 110 degrees outside and trying to grow something, we have the Black Church Food Security Network, the national office, has given us enough resources to hire dedicated farmers who can assist them. And we have recruited younger people to be the farmers. So when it's 95 degrees outside, those are the individuals going to give them assistance and to be able to pull the chairs for the elders of our churches to just say, rest under a tree for a little bit, tell us some stories while we do this work. So now we are also bridging the age gap. Young people are starting to come back to church as hands for these gardens. So there is that. Then there's water access, all the issues that go with farming. There's also the issue of most of our neighborhoods were built on ash sites. So we first have to certify that the soil is healthy enough to grow food. And when sometimes we find out that it is not, that's when we have to build raised beds and bring in our own soil and for that, we have amazing partners in Jacksonville who have not only give us good soil, but they also give us free compost. And then there's the issue of knowledge acquisition around farming. The ages between 0 and for the most part 55, I'm finding in residents in Jacksonville, most of them do not know how to grow anything. So then we have the 70 and 80-year-olds who sit back and say, I remember when I was in, when I grew up in the South, in Alabama, in Mississippi, in Georgia, we used to grow this. And they are now the resident subject matter experts on farming. And we bring them together. And sometimes we have magic and sometimes we have a lot of failures. For example, in one farm that I'm thinking of, we build a garden in a place that gets a lot of runoff. And when it rains, it gets flooded. So we lost a whole crop because we did not know that about this particular space. So then it's talking about what did we do wrong? What could we have done differently? And giving them enough resources, because we also have seed funding that can support that, giving them resources to get going.
So thank you very much for that. At least you have answers for the barriers, and you have discovered or have created ways to fix and repair those issues. Rachel, I want to ask you, I noticed that you and Dr. Husband have these backgrounds that say Feeding Northeast Florida. And I know that they're not growing gardens to put food that I see on those shelves and boxes. So can you tell us a little bit about Feeding Northeast Florida and perhaps how it's working toward creating a healthier community? What's your work with that, with Feeding Northeast?
Sure, absolutely. Thank you for asking. So yes, those boxes that you see behind both of us, those are, we are our region's Feeding America affiliate food bank. So there are 200 us across the country. So when you hear about Feeding America, you're hearing about us. And we a lot of the times operate in the background. We're the distribution. So if you think of Publix grocery stores, Publix distribution center gathers the food and then they send it out to your individual store. So we are like the distribution center. We gather the food and then we distribute it to, if somebody is getting food assistance in the 8 counties of Northeast Florida, chances are a good proportion of that food came from us. I love it when people have gardens to supplement that food, because connecting people with, where food comes from and the smell and that is beautiful. But when it comes to the volume of food needed to just try and keep the folks in these 8 counties afloat, that's Feeding Northeast Florida. And what we're trying to do to make our food stream healthier, we have quite a few health programs. I manage our healthcare partnerships. We're working directly with clinics to provide produce prescriptions to patients with diabetes, hypertension, and other medical conditions. We have some mobile grocery stores where people can come on and actually shop for their own foods. I do believe Bridge the Gap is one of the sites where we take the mobile market, and the clients love it. We're looking inward. We're looking at ourselves to see how can we do better? How can we get more fresh produce in the hands of our neighbors? I am actually right now at Feeding Tampa Bay, talking to them about their best practices, trying to learn how the awesome things that they do and bring that information back to us to help us do better in getting more produce, more healthy foods out there for free to our neighbors.
That is fantastic. And it's good to know that this work is not just happening in our community, it's happening in other areas of our state, other areas of our country. And you mentioned Feeding America, and Feeding Northeast Florida is just it's a small piece of Feeding America, and it's a great organization that is doing great work. You mentioned something that I think our audience should understand. You mentioned a prescription for fruits and vegetables. What do you mean a prescription? It's certainly not something that you take to the pharmacy. So, and it's a prescription that when we think of a prescription, we think of something that a physician writes a note on, he signs it, and he puts a message on for the pharmacist. So how does that relate to healthy eating and healthy foods?
Well, that's a good question. As a matter of fact, we do actually have a couple of food pharmacies in Jacksonville, and we're hoping to build more. We have it's a food pantry inside a medical clinic or a hospital where, yeah, the doctor will actually write a prescription. So the same way that you get, a free sample of your medication when you leave the doctor's office, physicians who participate in this program, they can actually write a prescription for the patient to go to. If it's a standalone food pharmacy, they can go there and get fresh groceries, meats, produce, healthy canned goods. And most of the time, people can come every week or every other week for a defined period of time. The goal is to help people manage their conditions. Doctors can write a prescription to come on these mobile markets that I'm talking about. So people can enroll in that program. We also have a home delivery program. So there's multiple ways, but it actually is a prescription. So your physician will enroll you in the program, and you'll either get a piece of paper to send you to the food pharmacy, or you'll get a phone number to call and for us to enroll you in the program and find a place in your neighborhood. It's actually pretty awesome.
Yeah, it does sound pretty awesome to me. I think it's fantastic that a doctor could write a prescription for fruits and vegetables, as well as they can write a prescription for medication and drugs that come from a pharmacy. We want to turn now to our audience. We do have one hand raised, and it is from Haseen Haywood. And Mr. Haywood, I am going to allow you to talk. I'm going to unmute you. And if you don't mind letting us know who your question is directed toward, and just ask your question. You'll need to unmute yourself. There you go.
Good evening, ladies and gentlemen, and thank you for hosting this event for us. So my question was directed actually into healthcare. I'm with Agape Family Health, and so I got the message. I decided to join in on this, and it sounds great. So my message instantly was like, oh my God, how do we connect healthcare with farming and teaching people actually how to grow their own food? That just invites them to eat a better diet and think about the choices that they're eating. So my question was, how do we connect that? And so Rachel, I think you mentioned a little bit about prescriptions, and I wish it would just work that smooth, like where we could just send a prescription and go over, I'm sure. So we'll have to get together and talk the details. So you kind of answered my question already there.
Oh, actually, I have good news for you. I have actually been speaking with Mia, your executive director,
Okay.
and we should be bringing our mobile markets to your clinics sometime in the next couple of months. So
that sounds good.
Agape clinics will be able to start writing produce prescriptions to the markets that'll be coming to the clinic.
Very good.
Awesome.
Mr. Haywood, ask and you shall receive.
Absolutely.
And you didn't even have to ask, almost ask and you shall receive, right? So I am going to thank you very much. We really do appreciate you asking your question. We have another.
And if I can just add to that as
Yeah.
well, because one of the things with the Garden of Eden Farms, we actually have clinicians, doctors that are working the farm with us. And as a matter of fact, the farm, Dr. Jim Moore, who was a family physician with Baptist, one of the things that he said when he came out to help start this garden is that this garden is going to cause doctors to leave their white coats for a little bit and come into these gardens and be able to teach the people about natural healing things, because you can prescribe medication, but a lot of times with medication, it fixes one thing, but it messes up something else. And so there was a balance that he said that he saw clinicians coming to work in his garden, and it is happening. And so we have extra physicians, and we're working on a curriculum so that when a community comes, they can sit and be taught by a physician in the garden to help supplement other things that may be going on. So with our partners with Feed Northeast Florida, with their mobile drops that they're doing, and then what we're doing at the Garden of Eden Farm, I think is really spectacular, because if we don't help change the mindset of individuals, we would never really reach the goal that we're looking for a more healthier America. So I just wanted to add that, because what we're doing at Bridge the Gap with the Garden is really humming into what Mr. Haywood was asking as well.
Well, thank you so much for stepping in and adding that, because that is important for us to know and to understand. As we begin to close our session, our panel discussion with our experts, I would like for each one of you to just respond to this, maybe take 30 seconds only, because we're out of time, and there's some closing things that needs to be said. It's important. What advice, if you could give everyone who are participating in this webinar right now, one piece of advice, I'd like for each of you to take 30 seconds and share what that piece of advice would be. And I will hand it back to you, Tonetta, for you to do that in 30 seconds.
30 seconds, come out and see. When you come and see, there's nothing like seeing it for yourself. So my advice, what you've heard today, come visit us, come visit and see and learn more about it, and how we are really helping to change the community, and how you can be involved as well.
Thank you so much. I appreciate that. Dr. Husband.
I would say that disaster that I talked about, it's coming. So take a personal responsibility. If you're a member of a congregation, a member of an organization that has land, and as an individual that has land wherever you live, grow something, grow food, not grass.
Okay, thank you very much. Rachel.
So quick piece of advice. I try and give this to all of my patients. Good nutrition is not complicated, and it doesn't have to be expensive. You don't have to buy somebody's special food. Take your plate about the size of a Frisbee, fill half of it with fruits and vegetables, all kinds of different colors. And in the other half, use a fist of a carbohydrate and a fist of a protein, whether it's a plant protein or a meat protein, and your fist is your portion size. And that's a healthy diet right there. No charge.
Thank you very much. Thank you very much. And I appreciate you all adhering to the 30-second time frame, because we do want to respect everyone's time. But now we have a participant who has a quick question, and I am going to, Dr. Reverend Gladys Turner, I am going to unmute you, allow you to talk, but I also would like to encourage you to stick to the 30 seconds with your question. Okay. Dr. Turner, you'll need to unmute yourself. Okay. All right. Well, we're gonna move right along, and we want to thank each of our panelists for being here this evening. And we want to thank you for sharing your expertise and sharing with us the things that are happening in our community that we all have access to. There's nothing stopping us from accessing fresh fruits and vegetables. We really do we really do appreciate you being here this evening, and we want to thank you again so very much. We are out of time for our questions, and what we would like to do is, if you'll put your question in the chat, we will reach out to these wonderful panelists at a later time, get an answer for you, and then get back in touch with you to let you know what their response is. And right now, I am going to turn it over to Zavanya Covington, who serves as our Community Partnership Coordinator for our faith-based partnerships and senior programs. Zavanya?
All right, thank you all so much. Thank you to our panelists. Thank you, Lynn, for such a fabulous job you did with moderating tonight's session. I do just have a few very brief announcements, closing announcements. First, our panelists have so graciously provided electronic takeaway handouts about their organization. So we will be sending those out to all of the registrants tomorrow. In addition, I have just posted the survey link for tonight's session. We just ask that you take a few moments to participate in that survey to share your feedback. As always, we so greatly appreciate those who respond to those surveys. They help us a great deal in navigating the content that we share with you. Also, take note, next month, we will be back here again to discuss the topic of mental health. So Ms. Tarenia Cross from the Baptist Behavioral Health will be here as our guest speaker. So please be on the lookout for that invitation tomorrow as well. And again, all are welcome. And lastly, please take note of all of our future sessions. We have now confirmed all of our virtual sessions for the remainder of 2022. So we will be sending out those registration links for each session in the coming months, but please just take note of the dates now and put those on your calendars. All of the sessions are scheduled from 6 p.m. to 7 p.m. So we look forward to seeing you at our future sessions as well. Again, thank you so much to our panelists. You've provided such great, informative, helpful information. We really appreciate you taking the time to be with us tonight. That ends tonight's session. Thanks again to all of our attendees for joining us, and we hope to see you again next month. Please spread the word. All right, have a great evening, everyone.